Okay, stand by. And let me get your agenda screen share. Okay, commissioners, take it away.
Good afternoon and welcome to the Lincoln County Board of Commissioners meeting. It is Monday, July 26, 2021, 3 p.m. Commissioner Hunt is excused from today's meeting. However, I'm Commissioner Claire Hall and Commissioner Katie Jacobson and I do constitute a quorum of the board. First up on the agenda is adoption of the consent calendar. These are routine items or items that have been vetted at previous meetings. And if there are no items that commissioners or staff wish to pull for individual review, I would entertain a motion for adoption of the consent calendar as presented.
Sorry about that. I make a motion to adopt the consent calendar as presented.
And I'll second that motion. All in favor of the motion, please say aye.
Aye.
Aye. The consent calendar is approved. Now we move on to decision and action items. We have one item, the fiscal year 21-22 nonprofit social service grant allocations. And Casey, if you could scroll down to the proposed order. And we had a discussion of this last week, and we talked about a new streamlined process, and also the fact that I'm pretty sure this constitutes a record number of applicants to the program, which is a good thing to see. Do we have any further staff report today, or Commissioner Jacobson? Anything that you'd like to share?
Nothing I want to share. I think it's a good list. I was glad to see we kind of redid the process a little bit to make it hopefully easier for everybody. And thanks to our committee for all of their work as well.
Indeed. So if there's nothing else to be said about this, I would entertain a motion for approval of the recommendations from our grant review committee.
I will entertain a motion, or I will make a motion to approve this as presented.
Okay, and I'll second the motion. Motion and a second to approve the proposed 21-22 nonprofit social service grant allocations. All in favor, please say aye. Aye. Any opposed? Okay, do we have Florence on the line with us right now?
I don't see Flo.
Do we want to maybe do the Echo Mountain Fire update and see if she joins us?
I'm fine with that. Yeah, because we are moving a little more quickly than normal, so perhaps, hopefully, she will be joining us in a minute or two. So we'll move on to report item B, the Echo Mountain Fire update. And Casey, are you ready?
Yeah, I am. And I would ask maybe if Christy Peter could reach out to Florence, maybe via email, just in case, just so she knows for sure that we're meeting right now. Thank you. I don't have a lot to provide today, commissioners. I would say one thing that was uncertain last week in the report was the location of the what are we calling it, Katie? And it's not an anniversary event. It's a
commemoration.
Yes, commemoration. And it sounds like the date is still firm on the 28th, but that'll be at the Lincoln City Cultural Center. So that is really my only report for you today. And I know Katie's got a lot still going on with funding, and I would hand it over to you, Katie.
Thanks, Casey. So just a couple of things to add, that FEMA is doing another re-engagement event Looks like they're looking at the end of August, so I don't think the dates are completely out in public yet, but they should be announcing that soon once they have location established, et cetera. Additionally, I think we're just down to 3 properties that are not cleaned up that we have not been able to make contact with, which is just huge. I mean, that's like really wonderful. So we're trying some creative ways to reach those last remaining few, and hopefully we'll be able to get them cleaned up here soon. Also on a funding end, later this week, I'm meeting with Senator Anderson and representatives from OCHS to talk about funding that they received through this session for wildfire survivor permanent housing. I don't have many details on that yet, hence the meeting happening later this week to kind of understand more of the constraints on that money and the process for getting it. So should know more next week. And we also, through our public works director, Roy Kenyon, made a request to the lawnmower fund, which I think I explained what that is last week, to get some money for roads. This will not cover all of the resources we need to repair those roads from the recovery process, but it's certainly a start and would help a lot. So that's my update.
And I would add, Katie, that that re-engagement event has been firm. It's August 21st through 24th. Again, it'll be at the Otis Fire Station. So a date has been set.
Excellent. Have we been able to make contact with Florence Portal yet?
No, we sure haven't. No.
Well,
So,
I do think that Susan sent us the email with the report in it. So
yes.
If you have that, Casey, oh, there it is. Look, we could just kind of start going through it, even though Florence isn't here. Yeah.
so there's page 1, and then page 2 for you starts here.
Well, it looks like even though the overall numbers are relatively small, it is concerning to see a 38% increase in cases from May through July 26.
Boy, yeah, it is nice to see that curve come down. But yeah, it looks like we're starting up on a little blip here on that second graph.
True.
Do you want to go to the next slide, Casey?
You bet.
Okay.
And again, I think one thing that leaps out at me right away is that, well, 18% of the cases, now I notice these numbers, 18% of the cases are among fully vaccinated people. 82% were not vaccinated, and 14%, I think that's a subset of the 82% group, are too young, below age 12, to have received vaccination. And 6 of the 7 cases of hospitalization are among unvaccinated people.
I don't quite understand what that one not related to COVID means under hospitalized.
I would assume that perhaps the person was a confirmed COVID case, but they weren't hospitalized because of COVID.
Yeah, okay, that makes sense. Okay.
Hey, there's Florence.
Hi, Florence.
Hi, my apologies. I was running out of another meeting.
Oh, we know how that can go. So why don't we, Katie and I were just trying to kind of make sense of the report, but how about if we turn things over to you to walk us through the numbers and have a conversation about where we're standing with regards to COVID right now?
Okay, that sounds wonderful. Thank you so much. So good afternoon, Florence Portal, Interim Public Health Director. Okay, so, this is not, I just want to bring about a little bit of concern now for you and for folks. It's not, really bad at this time, but it could get it could get a little worse. So as you can see, if you look at both epi curve, so the one on the top is the Lincoln County one, and the one at the bottom is the Oregon epi curve. As you can see, we are coming back up now, and so May, so you can see there was a 21% increase from the May numbers to the June numbers of cases, and then there is now a 14% increase if you compare the numbers in June to where we're at this time in July, which and the month of July is not over yet. Okay, we still have about 5 to 6 days of data to go, and so you can see an increase from May through July 26th, that is today, of 38% in cases reported to us. As you can see, we had a surge in April, and then we came back down in May, and we got all excited. We thought, oh, this is the impact of vaccination. This is great. And, you know, I mean, our numbers are still pretty low, even though they're coming back up. The reason for that, you can go to the next slide, please. So I'll go a little bit more in detail with the June and July numbers, and then I can give you some why this is happening a little bit. So we had a total cases from beginning of June to today of 125, average of 14 a week, minimum of 6, maximum of 23. So when you look at the vaccine status of folks, so out of the folks who are eligible to get a vaccine, it's not 125 cases, it's 108, because there are some kiddos who are, you know, not yet eligible due to their age, if they are younger than 12. But out of those 108, you have 82% of the cases that were not vaccinated or not fully vaccinated. And then you had 18% of the cases were fully vaccinated. So that means a few things. One, it means that, as we know from the stats, the vaccines we have available to us to protect us from this virus are very, very good, especially the mRNA vaccine, the Pfizer and Moderna vaccine. Even the Johnson & Johnson is very good, efficient vaccine. But what they're very, very good at is protecting us from getting a very severe illness if we get COVID, preventing us from likely having to be hospitalized, and possibly like protecting us from death. Even though really, really good, they're not 100% effective. And this is why we're seeing what we're calling those breakthrough cases, right? So it's a breakthrough case. It's somebody who was fully vaccinated and then waited 2 weeks after their last vaccination, and then still contracted the virus. So, you know, you can see also our hospitalization. We had, out of the 7 people who were in the hospital due to COVID in June, July, 6 of them were not vaccinated. So it's like about 86% of the people in the hospital were unvaccinated.
So Florence, that bullet point says hospitalized 7, 6 were unvaccinated, 1 not COVID related. We were speculating on what that was previously. So was that 1 person vaccinated and in the hospital not related to COVID, even though they had it?
Yeah. Okay. I think this is what happened, is that this person was in the hospital, and at first I think the team thought it was COVID related, and that was not necessarily the case.
Okay.
Yeah. So the other piece that I wanted to point out is when you look at this graph, so we went with a graph per week, right? And so you can see the various colors on the graph at some age categories. And so what you can see is that, so as mentioned on the slide, 30% of the cases in this time period are in the age category 25 to 49. But even if you add a little bit to this, you know, what is concerning a little bit is the week of the 18th of July, we're seeing a big rise and increase in the 65 plus. Okay, so this is a little bit concerning. And I'm going to tell you why it's concerning. On Friday, we learned that pretty much all of the specimens that had been sent to the Oregon State Public Health Lab in Oregon to be sequenced came back as a Delta variant sequence. Okay. And so what
was that samples from Lincoln County or from
no, from the state.
Okay.
Okay, we don't know yet. Lincoln County, we do not have specific data on Delta, but knowing what we know across the country and in the state of Oregon now, what we know is that last week, all the samples tested came back Delta, and I believe it was the past few weeks, now Delta pretty much represents 50% of the overall cases. So what do we know about Delta? We know it's very transmissible. And we know it, so because it's very transmissible, it's gonna spread faster, especially amongst the unvaccinated. And especially now that we have removed all the protective measures that we had in place, right? We're not wearing masks anymore. We're not socially distancing unless we are in a public transportation or in a healthcare setting. There is no requirement to apply any of those protective measure against the virus. So, you know, it's concerning. We also have plenty of tourism in Lincoln County, you know, that might explain people coming in from other places in the state, in the county, in the country, maybe from places where Delta is more prevalent. But so the question now is this, are we going to see more cases based on that data? I think yes. It's not going to stop, even though we're doing a really good job at, you know, having, I believe, like 72% of our population, eligible population vaccinated. You know, there are still 28% of the population that is not. And we see that even though the vaccine is protecting us, it's possible, for example, for a vaccinated person to contract the virus, possibly be symptomatic or asymptomatic and still transmit around, you know. So we really have to be mindful and think about all the people around us who cannot be vaccinated, you know, like the kids, people who are immunosuppressed, et cetera, et cetera. So I just thought it was important to bring, you know, this information to the table. I'm hoping, you know, we're going to go back down. I just want to raise a mini alarm.
Thank you.
Next slide, please. So now we're drilling in a little bit more and looking just at the July cases. So 65 cases in July. This past 6 days, 25 cases. As you can see, we had quite a bit around Lincoln City. We're really trying to figure out what type of transmission we were talking about. You know, like, do we have any outbreak or anything? No, you can see it's pretty sporadic transmission, meaning like it's really like we don't know where people have acquired the disease, which is a little bit concerning, right? Because this is less manageable, possibly. So what else do I want to tell you? You know, when you look at the cases, 48% in the 55 and older, So we're seeing those numbers again, right? Like people in the older age category, possibly more susceptible. And what was really interesting this week is to see that 47% of our cases were fully vaccinated, which means that, like I mentioned before, it doesn't mean that the vaccine is not protective. It means that those folks could have been way sicker than they are right now if they had not been vaccinated. Next slide. On a positive note, though, I think we're making some really good progress. We're almost at 50% of our 12 to 17-year-old getting vaccinated, which is way above the state average. I think we're doing pretty good on the 18 to 19, 20 to 29, even though we're lagging a little bit behind the state. I mean, there is definitely some work to do on the 18 to 49, if we wanted to meet the state numbers. But I think those are really, really good numbers overall. We had a chance of plus 106% from the numbers we had last week. So this is really good. We are at 31,445 people vaccinated in Lincoln County. So those are really encouraging numbers. I just want to say to people, even if you're vaccinated, if you want to wear a mask, please do so. It's absolutely fine to do that. And remember that when you wear a mask, you are protecting the people around you and then yourself. And seeing the numbers we're seeing this week, I myself have decided to put a mask back on. Next slide, please. Okay, and this is kind of like, the drilling down on those zip codes that were a little bit behind, we're seeing some good progress. Numbers are going up. It's slow and steady. And we are really, really targeting clinics in those specific areas. I believe this weekend we vaccinated. We had one event on Friday evening at La Rue Quilita where we vaccinated over 60 people, and like 40 of those doses were first doses, which was really, really exciting. And then we went to the Toledo Summer Festival on Saturday and vaccinated, I believe, 10 people, and 9 of them were first doses. So, this is good. So I think it's really important that we keep on getting people vaccinated to really try to bend that curve that is going up. Next slide, please. Any questions?
I don't think I have any further questions at this point. Commissioner Jacobson?
I had one, but you already answered it, so I don't have any further ones. Thanks.
Okay.
Thank you very much, Florence.
You're welcome, and apologies for being late.
Hey, back-to-back meetings, it's a fact of life these days. So thank you very much.
Thank you.
And now we move on to commissioner reports. Commissioner Jacobson, anything to share?
Nothing new to report other than what I've already said in the fire update.
And I don't have anything. So this is the time where we would normally take note of public comment. However, our public information officer, Casey Miller, informs me that we have had no public comment in the past week, which is certainly a first in some time, but people are welcome to submit public comment up till 2 hours before meeting time every Monday through the smart sheet on our county website. We do not have an executive session scheduled for today, so I'll just take note that the next meeting of the Board of Commissioners will be 1 week from today, Monday, August 2nd, 2021, 3 p.m., a virtual meeting. So until then, we will stand in adjournment. Thank you, everybody.